Hi, I'm Dr. Bhargav Raut, a pathologist with several years of experience from PathoFast Lab in Pune. Today I'm going to explain to you how to read a testosterone test report. We are specifically discussing the total testosterone test. You can see a format of the report on this slide. I've shown you what a normal lab report looks like when you go in for a testosterone total blood test. This is what it looks like, and now let's dive into what it all means. When you first look at the report, you're going to find that there are three parts to the report. Right on the left, on your extreme left side is the test name, that is the total testosterone serum, total testosterone, that will be the name of the test. The next is your result. This is usually the second column. In this page, you can see that the result of this patient is around 500. This is the second column of the report, and the third column contains all the normal ranges. Now most labs will include the normal ranges for almost all the different age groups and categories of patients, all in the same report. Some may only include the range that is relevant to your age and gender, but most of them will do it this way. I'm going to tell you what these different normal ranges mean and which is the one that you need to be looking for in your report. So the normal ranges start right from infants, where you can see the first thing on the top in blue. So there are two ranges there which are for premature infants. These are children which are born before the due date. So normally the pregnancy lasts for about 38 weeks. But if the child is born much before that, they are called premature, and these ranges apply to the testosterone levels in those premature infants. The next one is for all the infants between the age from the time of birth up to 2 years of age. So that's the one that I've put in yellow. You then have the ranges for children all the way up to 18 years of age. That's the one in the brown that I've put. Then you have the young adults, which is what we usually consider between 18 to 40 years of age. This is also the time during which the testosterone level peaks, and so if your age falls in that category, that's the column, that's the row that you need to look at. We then have older adults between 40 to 60, and then the senior citizens which are more than 60. You should know that the testosterone levels keep falling after the age of around 40. They keep falling gradually, and they will go on reducing as you get older. And right at the bottom we have something called the Tanner stages. These Tanner stages are only something that doctors will usually refer to. You don't need to look at this yourself if you're a patient. These are different stages of puberty which only doctors know about. Doctors know what should be the changes in a person's body that takes place when that person is attaining puberty and at what stage. And there are testosterone levels for every stage of this puberty, which are called Tanner stages. So these are what the normal ranges look like. The way you need to look at this is just take a look at your age and look at the row that represents your age and only compare your value to that.